Thank you so much. Dr. Henry, I just want to ask you about schools. Here in the central Okanagan, we're seeing the list of schools and exposures growing. And if that trend continues, at what point do we decide to make any operational changes at schools? And is closing schools a possibility?
Yeah, so we know that, and the data has borne it out, and we'll talk a little bit more about that on Thursday. But we've seen around the world, and we've seen it here in BC. What happens in schools reflects what's happening in the community. So we have seen exposures, quite a few of them, in schools around the province, but of course particularly in the Fraser Health and Vancouver coastal areas, but also, as you know, in the interior. But we see very little transmission in schools. So that tells us that the layers that we have in place in schools are working. And that, so right now, what we need to do is focus on reducing transmission in the community to protect the important aspects of schools, and that includes in-classroom schooling.
Do you have a follow-up, Claudia?
Yes, just a quick one. If things do get so bad that we do have to transition to online learning, and I realize the Ministry of Education would probably have more specific details, but do you know how prepared we are to make that switch efficiently and smoothly?
Yeah, as you say, that's a question that you can ask the Ministry of Education. I know that it is part of their planning. My perspective is the health aspects, and we know that online is a challenge for many children around this province, and that underscores the importance of in-classroom learning for children everywhere in BC. And that's why we are taking the measures that we've took in the past couple of weeks to focus on reducing our social interactions, those interactions in our community that have led to spread, so that we can protect our schools and continue to have our schools operating appropriately.